This is the MPT Soft Tissue Tool being used to treat patella tendonitis. This is a combination of patella tendonitis and a knee strain. So we're using the MPT Soft Tissue Tool using the smaller radius that conforms well to this area. And we're starting off, you can see the tool is held at a 30-degree angle, roughly a 30-degree angle, to decrease the pressure that's being exerted on this area. Right now we're using the angle of the tool to get into the tougher areas to reach, which is by the medial and lateral meniscal area, medial and lateral joint line. Right now we're concentrating on the medial side of the patella tendon. So this injury was more generalized, so we're trying to get a larger area. We're getting the entire patella tendon region, we're getting medial side, lateral side, and what we're trying to do, we start off, what you want to feel is a granular sensation. Well, if you do feel that, that's indication of tissue adhesion, scar tissue buildup, and it's that tissue that will restrict mobility and tissue pliability and function of the joint. So we're going in there with this tool to try to break down that tissue adhesion, break up the scar tissue, and then return that tissue back to normal functional pliability. And then after that, range of motion, mobility, and strength follows. So we're going back and forth, medial, lateral, right now staying right on the patella tendon. Again, using that tool at about a 30-degree angle to decrease the pressure. There's not a lot of muscle tissue there or fat tissue, so we want to regulate or grade the amount of pressure that's being applied to that area. So we keep going. You want to go until you're finding a decrease of that granular sensation. We're going to apply ice to follow, just to decrease any soreness that may be experienced after the treatment.